Go on bypass, please.
Okay, going on bypass.
When you're going on bypass and you stop the heart and you have to then take the patient off the bypass and everything works fine, you've got this signs of relief. I don't want to compare because it's not comparable, but maybe when the pilot is landing, even if he did it million of times, this is exactly the same, I think, feeling.
Okay, we're on full flow.
Thank you.
The heart problem was brought about by having to have work over to check whether I was strong enough to take a kidney transplant. I've known about my kidneys for about 20 odd years, and over the last 3 years they've really gone downhill to the point where it's now only working at about 5%, so I need to go on dialysis. So I went on the transplant list, and to do that they check your heart's strong enough to take it, and that brought up this problem I've got with the aortic valve.
How do you do? Okay. Feeling sleepy?
So Eric suffered from a disease called aortic stenosis, which means that one of the valves in the heart is narrow, and the heart needs to work really, really hard to push the blood to this narrow valve, causing a lot of stress to the heart, and also patients feel very tired and they've got shortness of breath. This is the biological prosthesis. So this is the replacement that we put in the place where your original valve is. It's just opening one direction, and when the blood is coming from this side, it will firmly close.
Yes, we want to stop it, and we did, and the heart is not beating, so we just need to wait until the solution will fill the heart, because what you want to really you want to have a heart which is not working, because then all energy which heart is using is actually preserved to keep it alive. So we've got quite a lot of time. We've got 30 minutes now before we have to give it again. So we will be able to open our aorta, get to the valve, take the valve out, then we will give it again.
He's very confident, inspiring, I have to say, Adam. Very pleasant, puts you at your ease, explains everything, even all the technical and medical things. He makes it sound as though, oh, I know exactly what you're talking about. You know.
Well, I'm just trying to gently maneuver this valve inside the position that the previous valve was, and it's in the place. Now we just check if sitting nicely, and we will tie it.
I think the successes of the NHS are very much hidden. There's a lot of negative sentiment about the NHS at the moment. There's a lot of people complaining about what it costs, mainly by people who never use it, not had to use it. It's only when you start using it and realise the difference it makes, you don't have to worry about the cost of it, you don't have to worry about anything really. You just take over, do it, sort your life out for you, and give you a new life back.
Oh.
Well, we're grateful, apart from anything else. The treatment that he's had, I don't think either of us could fault anything.
Hello, nice to see you again. Please have a seat.
Lovely, thank you. I've been discharged, which is wonderful news. But he's always there if I need to chat to him. It's a very special relationship. It's hard to describe. It's not a normal relationship that we have with people. I had about 3 to 5 years left of life, and now I've probably got a normal life left. So quite incredible, really. And he just takes it as a matter of fact. That's just, his job, and he must get some kick out of it, I would have thought. I would hope so, anyway.